While the infection rate among children remains relatively low, there has been an increase in COVID-19 cases in the younger age group. The American Academy of Pediatrics says they have seen a 16% increase in infections. Channel 3's Kara Sunland spoke to a doctor about what parents need to know.
Joining me now is Dr. Juan Salazar, the physician-in-chief and executive vice president of academic affairs at Connecticut Children's Hospital. Thank you so much for being with us, doctor.
A pleasure to be with you.
We are hearing that more children are coming down with COVID than before. Is that the case here in Connecticut?
Yes, as part of the second wave nationwide, we have seen a dramatic increase in the number of kids. Back in April, maybe 2% of the kids had COVID. Over the past 2-3 months, 12% of the kids nationwide represent COVID-19. And yes, we have had many more kids hospitalized at Connecticut Children's because of COVID-19 related disease.
And that's scary because a lot of times people think that they can't get it seriously. Why do you think kids are getting it in higher proportions now?
Yeah, that's a great question. I think part of it is that we have greater testing, so we have more ability to diagnose them as we did back in April, but we also have wider community spread. So this virus, unfortunately, has gone into our community, into households where kids are present, and it's being passed from one person to another, including many, many kids. Now, again, fortunately, the good news is most kids will do fine. I just want to make sure we don't, make the parents very, very frightened about this. But some of them, unfortunately, do end up in the hospital, and we have seen some of them at Connecticut Children's.
Is there a trend as to where the kids are contracting the virus, like daycare, school, after-school sports?
Yeah, the Centers for Disease Control recently released a study which shows that the problem is really not at the schools. If the schools are properly distancing, they're using masks, they're using proper procedures, keeping them in one classroom, especially in the elementary school and the middle school, that's not where the kids are getting infected. I think for the most part, what we're seeing, and we believe, it's taking place in households or gatherings, getting together with other friends outside of school. Now, in some cases, it may happen in the school, but most of this is occurring within the community settings and not in the school.
Now, is one age group being more impacted, like teens versus young children?
It really affects the whole population, the whole gamut, kids all the way from age 2 or 3 all the way up to 16, 17, and 18. Teenagers, by definition, gather they're more likely to gather in groups, and so we do have a large proportion of the teenagers that get infected as they get together in social settings where they're not properly distancing or using masks.
Real quick, last question. Does this have anything to do with the new variant from the UK?
Not at this point. Connecticut has identified the B.1.1.7 variant, which is thought to be more contagious, but there's no evidence to show that it's the reason that we have an increased number of cases in the United States. We have to monitor this, though, because it certainly could happen that a more contagious strain would then affect more kids in the younger population. So we got to keep an eye on it, and we're doing that.
Thank you so much for sharing this important information.
Thank you.